Okay guys, this is my patient with the extractions we've been doing. We got a couple in the ear here we're gonna do, and they come across here in front of the ear. Overall, her forehead's doing great. She had so many inflammatory bumps there before. There's a couple that are refilling that we're gonna get, but overall she is really kind of drying up. I would say probably 80% improvement up here on just 2 extractions. Same here, you can see she has some light post-inflammatory hyperpigmentation, but that bright red is starting to go away and fading into these light pink and light brown, which will keep fading with the medications that we're doing and getting some of these. You can see if you pull the skin, we're gonna get some of those clogged pores today too. When we come over here as well, you can see her inflammation's going down, but she's still got the comedones, these whiteheads, milia, clogged pores. So that's why we do these extractions. Waiting for a retinoid to do this could take a year or more. And doing the extraction, getting those pores cleared out will make her clear up a lot quicker. So we're gonna start with the ears today here. So, hey guys, Mr. Popson here. We have number 3 on our extractions here on the forehead and the ears. And we're going to be going in the ear. I have a Miltex extractor. We have several different extractors. This is actually one of my favorite. Little cup there that you can see. Comes with its own little kind of, to open the pore here. This is a great extractor, very specialized when you can put that direct pressure down. And I like to do that in the ear. So I use different extractors for different areas, but this is one I like to use for the ears. But this is the first time I've actually done a video with it. So we'll come over here. I'm going to turn my light on. I'm going to have you turn a little bit more. And these can be a little painful, so we're going to go nice and slow here. And we're going to open up that pore first. Just do a little disruption there. And a little disruption there. Let me come up here. And a little one there. Just kind of get that pore open. So that direct pressure then relieves it a lot quicker. So we're going to come to this one first and put that cup directly on there. Little pressure, it's cartilage behind it. So we're going slow. A little pain there. Sorry, you doing okay? Good. And it's starting. Go to this one too here. That one's a little looser, I can tell. And it usually comes out right into the cup. Another here. Direct pressure, you can see that. Sorry, that's a little tender there? Yeah.
Yeah.
You did great. I got it in that cup. You can just scoop it right out of there. So that's good. I don't think these two are as deep as the other one was. Good. Turn a little bit this way. There you go. There's not much left in this one. We're just going to do a little pressure. Sorry. Hopefully not as painful as when your sister did it.
No.
Good. Yeah, we're getting, there we go. A little plug coming out. Very good. You can see that little yellow snake. There we go. Very nice. And then let's finish up with this one here. A little shake, trying to get that to break free. Got it? Good. It's just a little bit left over on that one. And you can see when we press, even that oil coming out of there, she's got these other little pores here. Just light pressure. You can see it fills the cup as we scrape across, because it's just a lot of oil. Overproduction of oil. Retinoids do help with that. But that's good. We got those pores unclogged. We're going to come out here now. She had a couple blackheads. This is a pretty tender area. I don't like to push because there's a nerve that comes out right there. So I'm not going to do downward pressure. We'll do a little sideways pressure here and pop out that plug with a nice finger squeeze. Just like that. Another one here. A little sideways pressure. Good. Just like they do in the Asian spas, you can see there, putting them on my glove. I'm just kidding. I'm not going to keep them there, though. That's what they do in like Vietnam, and you see some of these, they just keep it all over their glove. It's a little gross. I know, and then it falls and smears. And up here, yeah, so we have a little inflammatory pustule there we're going to get. We can Q-tip on this inflammatory one here. I'm going to get that plug out. Not too bad? Good. Yeah. It's a good pocket there. It was filled. We had 2 blackheads right beside right there. So let's get those out. A little pressure, good. Got it. And we're gonna do a little bit. I think she had a small one here. There we go.
Just spread it out.
Yeah, that one just popped right out. Kind of shot. That was
quick. I almost didn't get it.
I know. It was a quick one. So that's good. Okay, I wanted to get those big blackheads that she had coming across the ear and outside of there. And then we're going to go back up to the forehead. She still has one blackhead there. Let me get a couple of these. Okay, clear a couple pores here. It's right over a bony prominence there. Good. Perfect. And it looks like possibly a blackhead still residing right there. I'm going to try and get that. There we go. Got it. I was trying to hide in that inflammatory pustule. Good. Another one there. Good. And we'll come out here. I think I already got this. There's not much in that one. Very good. Okay. Nice. So we're gonna come back up. You ready? So this is the one that we had before. It was quite big actually. Most likely it could be a little cyst in there, just a deep pocket. We drained it 2 or 3 times now, and it's only come back to probably 30% of what it was originally. So it looks like kind of shrinking the pocket that's in there, which is good. As we keep kind of extracting the contents, we're hoping with topical retinoid, we're going to get that pore to lessen its oil production and kind of tighten it up with time and hopefully shrink the pocket that keeps refilling. You can see that's way less than we've gotten in the past, so that's good. Very good. We'll come over here. Now, she had a big one right here I see that's trying to come back as well. A little pinch. This is kind of a deep pocket there as well. Very good. That is looking good. Turn a little bit more, and we're going to come through and just get some of those comedones real quick. Okay, come across here. full pocket there. Very nice. Sorry, almost got a hair there. Almost pulled it. Okay, turn this way a little more. And come right across on these little. Good. The first couple of rounds, I go for the really big ones first, and then as we come through, we start going to these little clog pores. Still medium size, I would say. And we'll get them all clear here soon. And one more there. Very good. Okay. Any ones that are stragglers here falling off. Very nice. So that's looking good. Very smooth compared to the beginning. So we'll come down here and do a couple of these little clog pores on the cheek. Okay, continue down. This was a little deep one, inflammatory one here. Sorry, a little pressure. Those could be kind of tender. Get that little pus pocket out of there. Good. And now we'll go to all these little comedones you can see there. We'll do this round here, and then we'll probably give you a break. Good. Lots of keratin, dead skin, and oils mixing together, causing all that white discharge. There we go. Looking good. We're going to come down here. You can see a little tiny slits with the 11 blade or 18 gauge tip. They don't leave any permanent scars. Just gives you a little opening on these pores.
Just not enough Q-tips.
Yeah. And this gives us just enough opening that we barely have to push. You can see how easily these come out now, which is what we want to see. We'll stretch the skin a little there. A lot on those. Perfect. Some fresh tips there. Good. Now this is an area here that can be tricky because it's down in the cheek there. So a lot of times I will stretch the skin up onto the cheekbone there, and that gives you a little bit of back pressure, which is nice, can help. That way we just have to squeeze, not quite as deep. Perfect. Two more tips. We get all the angles that we can here. Good. Pressing. The Q-tips are nice in this area because we're getting good side pressure. Pushing it from the side, down and up, instead of just right into the cheek. Perfect. Okay. Cleared quite a few of those. We'll get this little grouping and then we'll give you a break. I know that's a lot of pokes today and squeezing.
These actually don't hurt.
Not bad? Good. Yeah, you'll see kind of a lot of people in the comment section. He's pushing too hard. That hurts. I bet it hurts so much. And that's why I always ask my patients, how you doing? Does it hurt at all? Little inflammatory one right there. Get that plug out. Perfect. Couple right here by the mouth. There we go. This can be a sensitive area by the lips there too, so a little bit of underneath pressure. And remember the teeth, and then the gums are right there where the teeth go in, so that's a very sensitive area. So we try not to go too deep there as well. Just a couple more, and that'll be it. Right there's a good one. It's dry. One more right in the middle there. Okay, cleared that whole group here all the way up and across. We're going to come back. We got some of her inflammatory ones. She's got some more coming through here and on the other side. The big one we did on the nose went away, which is good. And then we come over here, she's got just some small groupings coming down here. So maybe 1 or 2 more treatments and she should be good. And she's getting great improvement. I'd say she's probably 80% in most areas. So it's looking good, and this will dry up. She's not going to have any permanent scars, nothing there. So looks good. All right, guys. Thanks for tuning in. That's another good extraction video. We did a couple different techniques there that you could see. And you can see it's working along with her retinoid. She's having great improvements. So thanks for popping by. Hey guys, Mr. Popsy here. Thanks for watching the video. Make sure to hit that subscribe button and hit the notification bell so you get notification when the next video is coming out, because I got a lot of content coming your way. Thanks for popping by.